Hello everyone, this is Dr. Cui. So in this video, I'd like to talk about another question that was asked by an interviewer during the interview. What are some traits of a good internist? So actually this question is pretty easy to answer. We can always use a answer from another question. What's your strengths to this one? Because there are a lot of similarities here, and you can talk about you are good at time management uh, uh, you are good at communication, or you are a conscientious person who always pay those details to the patient. You can, yeah, so actually there are a lot of answers for this question, but obviously remember to add a short story or your experience, your own experience to prove your point of view, and also add a reflection at the end of each story or experience, show that why it's good for you to become a doctor, in order to let the interviewer remember you after the long conversation, instead of just memorize those interesting case or stories. So here I will give you I will give you an example of mine. So here we go. Hi, Dr. Cui, can you tell me some good traits of internist? Yeah, definitely. I think as an internist, we should be good at communication. We should be hardworking people, and also we should be conscientious. And there are a lot of those good traits. But in my mind, conscientious is one of the most important traits as a doctor, especially as a resident doctor. For example, when I was doing rotation in New York City, there's a patient who is 60 years gentleman with lung cancer. So my attending want to start immunotherapy for this patient. Well, I know this patient complained of ear drainage before seeing my attending, so I reported to my attending, who further confirmed it with the patient primary care doctor. So we just send the patient to his primary care doctor to treat his ear infection first. So you can see in this experience, I think so I'm always try my best to make sure that our treatment plan or medication won't cause a second damage to my patient, and the details is very important to treat a patient, especially as a resident doctor, and we need to be responsible for those details for our patient. And whenever the attending make a treatment plan or medication for the patient, we always need to make sure that there's no contradictions for the patient. So that's our job. Patient safety always comes first. So you see that in this answer, I talked to the interviewer that I think many treats, good treats as an internist, but I just focus on one, the conscientious. So then I can just tell him my own experience, and also after that I add a reflection that why it's important for me to become a doctor, why it's very important, why conscientious is very important as a doctor, and so I hope it's also helpful for your answers. Good luck.